Top 10 warning signs of silent heart attack you should not ignore. When you think of a heart attack, you likely envision someone clutching their chest and collapsing. However, a silent heart attack is far more insidious and challenging to detect. This type of attack doesn't present any noticeable symptoms. Consequently, many individuals experiencing a silent heart attack remain unaware until further testing reveals the truth. How common is this? Out of an estimated 805,000 heart attacks each year in the US, around 170,000 are silent. Since it can go unnoticed, it has the potential to cause significant damage, and without treatment, it can be fatal. However, certain telltale signs can indicate whether you are at risk for a silent heart attack. In today's video, we'll share the top 10 warning signs of a silent heart attack that you should not overlook. 1. Jaw, neck, or upper back pain. When identifying the indicators of a heart attack, many individuals commonly associate chest pain as the key symptom. While chest pain is indeed a primary warning sign, it is not the sole one. In reality, numerous individuals who have experienced a heart attack have reported feeling pain in their neck or jaw before other symptoms such as shortness of breath and nausea manifest. This occurs because during a heart attack, the cardiac muscle contracts forcefully, potentially exerting pressure on bones and ligaments, resulting in discomfort in the jaw or neck. 2. Excessive fatigue. Persistent fatigue, characterized by constant feelings of tiredness, is an early warning sign of a heart attack. According to a study conducted by the American Heart Association, which analyzed 515 women who had experienced a heart attack, 70% reported experiencing unusual fatigue prior to the event. This occurs because during a heart attack, the heart is under additional stress as it attempts to pump blood while facing blockages in blood flow, resulting in fatigue. While fatigue could be attributed to factors such as workload or changes in sleep patterns, if you find yourself feeling consistently tired without an apparent cause, it may indicate a silent heart attack. 3. Squeezing chest pressure. When you feel pressure in your chest, it indicates a potential issue with your heart. This sensation is often referred to as anginal or substernal chest pain. Typically, the pressure manifests as an uncomfortable squeezing feeling in the center of your chest, resembling more of a cramp and lasting for several minutes. If you ever encounter such discomfort in your chest, it's crucial to take prompt action to mitigate the risk of enduring damage to your heart. Other causes of non-cardiac chest pain may stem from issues related to the esophagus, lungs, stress, anxiety, or musculoskeletal injuries. 4. Sweating. Perspiring when feeling warm or during physical activity is a natural bodily response, and a certain degree of sweating is normal. However, if you notice yourself sweating even when inactive or in cold weather, it could indicate a more serious underlying issue, such as a heart attack. When your arteries are obstructed, the heart requires greater effort to pump blood, prompting your body to produce more sweat in order to regulate body temperature during this heightened exertion. Therefore, if you're experiencing excessive sweating along with other warning signs like nausea, dizziness, and lightheadedness, it's imperative to seek medical attention promptly. 5. Bloating, nausea, or poor appetite. The sensation of fullness despite consuming a small amount of food and experiencing nausea could indicate the onset of heart failure. This occurs due to fluid retention and inefficient heart pumping, resulting in a decrease in circulating blood volume, which is then redirected from the digestive system to vital organs like the brain. Over time, this process can lead to weight and muscle loss. Therefore, if you notice sudden changes in your appetite without an obvious cause, it's advisable to undergo a medical evaluation. We're halfway through our list, and we hope you found it informative thus far. Don't forget to subscribe to our channel, hit the like button, and enable notifications for more content like this. Let's continue with the video. 6. Lightheadedness or dizziness. During a heart attack, a specific part of the heart is deprived of oxygen due to a blockage in the blood supply. As a result, the heart struggles to pump enough blood to supply the body's functions, leading to sensations of dizziness. However, some individuals may experience dizziness as a symptom without any other accompanying indicators. In such cases, these episodes are often triggered by factors like stress or dehydration. Nonetheless, if you consistently experience dizziness, it's essential to consult your doctor to rule out any potential underlying serious causes. 7. Difficulty breathing. In addition to the steady rhythm of the heartbeat, the automatic process of inhaling and exhaling performed by the lungs often goes unnoticed by many individuals. However, any dysfunction in this process becomes quite apparent. Shortness of breath manifests as an inability to breathe efficiently, with sensations of heaviness in the chest or a strong urge to breathe rapidly and shallowly. While it can be triggered by factors such as anxiety, anemia, or allergic reactions, it typically indicates underlying issues related to the lungs or heart, particularly more prevalent in women. Regardless of the cause, shortness of breath should never be disregarded as a symptom. 8. Swollen legs, ankles, or abdomen. Swelling occurs when there's an accumulation of fluid in the body. During a heart attack, the heart's ability to pump blood effectively diminishes. Consequently, blood may accumulate in the legs, ankles, and feet, leading to edema. Additionally, the disrupted blood supply to the kidneys hampers their capacity to eliminate sodium and water from the body, further exacerbating fluid retention. Edema serves as a warning sign of a heart attack in approximately 20% of cases. If you observe these signs in yourself or someone else, swift action is crucial. Seeking medical attention promptly increases the likelihood of preventing further complications arising from a heart attack. 9. Persistent flu. Experiencing persistent flu symptoms that linger could be a cause for concern. Research indicates a link between flu and a heightened risk of heart attack and stroke. According to a 2018 study, the risk of heart attack escalates six-fold within a week following a flu infection. Although influenza itself does not directly cause a heart attack or permanent damage, it may suggest underlying health issues that predispose one to heart disease and other cardiac complications. This concern is particularly noteworthy if symptoms manifest alongside an elevated regular heart rate, shortness of breath, or other indicators of heart disease, such as chest pain or pressure. 10. Trouble sleeping. Certainly, sleep disturbances can signal underlying health issues. A study featured in the journal Current Cardiology Reviews highlights that individuals experiencing disrupted sleep patterns face an elevated risk of heart disease. During a heart attack, the left coronary artery may become obstructed due to fat buildup or a blood clot, impeding adequate blood flow to specific regions of the heart. Consequently, portions of the left ventricle are deprived of oxygenated blood, leading to dysfunction. In response, the body releases alertness hormones such as adrenaline, noradrenaline, and cortisol, which can disrupt sleep patterns. Therefore, if you find yourself unable to achieve restful sleep and spend the night tossing and turning, it may indicate a significant issue. Prioritizing heart health is paramount, as heart attacks remain a leading cause of mortality worldwide. Implementing simple lifestyle changes like adopting a nutritious diet, engaging in regular exercise, and abstaining from smoking can substantially mitigate your risk. If you notice any signs or symptoms and are unsure whether they are cause for concern, it's best to consult your physician to be safe. If you believe you've experienced symptoms of a heart attack, call 911 immediately and seek help without delay. Even if it doesn't seem serious at first, taking quick action could save your life. If you enjoyed watching this video, don't forget to like, subscribe and turn on the notification bell, so you don't miss any new videos. Let us know your thoughts about this video in the comments section down below and feel free to stay and enjoy it until the end. Also make sure to check out our next highlighted video and we will see you next time. Thanks for watching. Please like, share, and subscribe.